evening to all. My name is Megan Diggs, and I'm a registered nurse that specializes in emergency care. I would like to share with you all my support in the efforts to push for the Patient Affordability, Value, and Efficiency Act to be passed and implemented. It is to my understanding that this bill will aid in providing new methods of payment in return for pharmaceutical goods and other healthcare services. This is in hopes that individuals will have the necessary access to health care. I am in support of this bill because I am a registered nurse. Consequently, I see how this could benefit many people that I serve on a daily basis. Not only that, but I have a close family member that would have a huge impact as well. To put the financial strain that many patients experience into perspective, I will use my brother's situation as an example. My brother Matthew was diagnosed with type 1 diabetes in 2004. A few of the pharmaceutical goods that he needs to properly manage this disease includes insulin, a glucometer, lancets, syringes, glucose tablets, and testing strips. Not to mention, he has regular quarterly checkups to assess his A1C levels. Even with his insurance, his copays are very costly. The original price of his pump that he has now was $15,000, and after the insurance, his payment that was left was $700. He also pays $350 for his pharmaceutical goods monthly. I see patients every day for hyperglycemia, kidney failure, and poorly healing wounds. This is a result of poorly managed blood glucose levels. We're referring them to get consults with podiatry, dialysis, and even surgical disciplines for amputations. These complications are all due to noncompliance. I ask them, why do you not keep up with your blood sugar levels? The sad and honest truth always involves the lack of health insurance and overall funds. Plus one studies also revealed that individuals are suffering and are acquiring premature morbidities simply because they cannot afford minimal health care. I personally believe we should emulate the French healthcare system in order for this policy to be implemented correctly. The French healthcare system covers both public and private hospitals, doctors, and other medical specialists to provide French health care to every resident in France regardless of age, income, and status. This makes the French healthcare system highly accessible for even foreigners. Additionally, the majority of French healthcare costs are covered by the state via public French healthcare insurance scheme. It is compulsory for residents in France to register with a French health insurer, as well as register with a doctor in France and go through this doctor for most treatments in order to properly reimburse the French healthcare system. In France, if you are unemployed or your annual income sits under the government thresholds and you do not have private health insurance in France, you are eligible for free complimentary state-funded health care. Anyone working in France will have social contributions automatically deducted from their salaries to cover their state health care insurance in France. Costs vary according to a number of factors, including your income and household, but it averages around 8% of your net income above a minimum threshold set by the state. Retirees and non-resident taxpayers typically pay less. Of course, the question is, according to Institute of Medicine Committee on Assessing Healthcare Reform Proposals, they recommend that proposals such as this policy reform should explicitly state several factors. The first being describing anticipated sources of financing. In this case, I suggested that we emulate the France's healthcare system, how they go about financing. And I mentioned the healthcare insurance that the state has there. I mentioned that, and the second factor should also include identifying the expected level, distribution, and timing of savings expected from this policy. And of course, this will be able to create savings in patients' pockets, and ultimately, I believe that hospitals and other foundations across the country will be able to create more of a profit because people are actually going to facilities to seek healthcare help. The third factor is estimate the level and distribution of public and private expenditures. This distribution will be well versed for citizens throughout the whole country, um, and it may even be positive affecting for those who live internationally as well. All economic statutes from high to low levels will be positively impacted. The fourth factor is describe financing not only for healthcare services but also for basic elements of the healthcare infrastructure. So I was saying that decreasing the cost of healthcare services should include public and private healthcare sectors, public health facilities, research units, educational units, and capital investments. By implementing the Patient Affordability, Value, and Efficiency Act, individuals will have the proper access to health care. According to Health Services research, financial strain may force individuals to choose among competing demands, such as skipping meals to pay for medicines or delaying healthcare visits to pay for utilities. And an individual should not have to choose between basic survival needs and access to healthcare or pharmaceutical goods. This will have a positive financial impact on individuals throughout the country. Thank you.